Hello, everyone. Good evening. My name is Christopher Booth. I am a senior enrollment manager here at Western Atlantic University School of Medicine. This is our virtual information session for April 2nd. Thank you all for joining us today. Before we get started, let me make a few introductions behind the scenes, and then we'll introduce our on-screen panel. My colleague Xavier Marcus, who's also a senior enrollment manager, will be answering any questions that you may have. So as we're going through today's presentation, if you have any questions that come up, please feel free to drop them in the chat. We will do our best to either answer them in the chat or try to incorporate and answer them during our conversation as well. So if something doesn't get answered almost immediately, just know that we may be coming to an answer later in the presentation, or we're going to get an answer to you. Also, my colleague Tibian Ahmed is going to be checking you in. So if you join today's session and your name is iPhone 15, Tibian may reach out to you in private message and just say, hey, can you confirm your first and last name for us? Because we want to make sure that we mark you as present. So with that being said, let's get ourselves started here. Let me introduce today's panel. First off, we have our Provost and Chief Operating Officer, Dr. Paula Wales. Thank you for joining us. Then we have our Campus Dean, Dr. Laura Welke. And next to Dr. Welke is one of our pre-clerkship first-year students, Nicholas Perry. And then we have joining us all the way from Chicago, one of our clerkship third-year students, Tiffany Fan. Thank you all for joining us today. So awesome. Let's get started. So Western Atlantic University School of Medicine is a med school. We are based in Freeport, Grand Bahama Island, with the majority of our clerkships taking place in Chicago at either St. Anthony's Hospital or Insight Hospital in Chicago, though there are other hospitals that you can do some of your electives at, but we will be talking about that a little bit later. But in order to kind of get us set up here, Dr. Wales, recently WAUSM has achieved several key milestones, and I wonder if you'd be willing to talk us through some of those milestones, like our USMLE Step 1 and Step 2 pass rates, OSCEs, and maybe, if you're willing, talk up a little bit about our match rate.
Well, thanks, Chris. I'm happy to share. He knows this is my favorite question, so he tosses it to me right at the very beginning. And I'm really proud of our faculty and our students and our curriculum and our staff and everyone who is at WASM. And the reason I'm starting with that is because I think it takes the whole community to support our students in the way that we support them. And so I'm very happy to share that our first cohort that sat for Step 1 passed Step 1 on the first time at 100%. So 100% of them passed Step 1 on the first attempt. That cohort who then went on to take Step 2, 100% of them passed Step 2 on the very first time. So those are great statistics, super statistics. Then that group went to take what's called an OSCE, an objectively structured clinical examination. So Step 1 and Step 2 are written exams, so it's largely based on the computer. An OSCE is an exam where you walk into a clinic room, there's a patient in there, and there's a camera in the ceiling, and there's a microphone feed, so faculty watch your interaction with the patient. So it's a skills-based exam. So we know they were doing great, 100% on the written exam. On that skills-based exam, 100% of them passed on the very first attempt. And the reason that's important is that exam is externally evaluated. And what that means is there are faculty who teach at medical schools all over the Chicagoland area who come together and evaluate students from multiple medical schools, so including ours. So our students were up against the students from Rush and other places, UIC, other places in Chicago. So we were very happy about that. Then that group went through the very first group that participated in match from WASM. So match, actually there were two matches. There's the Canadian match, so it's called CARMS. It's the Canadian match process. And then there's the NRMP, which is the National Residency Matching Program in the US. So CARMS is actually tougher to match into, in my opinion, because there are fewer slots. We had one student enter that match, and she matched. So that's 100% for CARMS. And then we had another group of students, 16 students, enter the NRMP match. So that's the US match. All 16 of them matched. So I am so proud to say that 17 of 17 students, or 100% of our students who entered the match for the first time, uh, matched. So thank you for letting me say that, Chris, because it's the best. It's the best news to share all night.
So I just want to follow up with you, just to confirm. So what you're telling me is that it's 100% USMLE Step 1 pass rate, 100% USMLE Step 2 pass rate, 100% OSCE pass rate, and 100% match pass rate.
Yes.
Amazing. Dr. Welke, going to you. How would you attribute to the success of the WAUSM students thus far?
Wow. It's just, thank you. First of all, it's a pleasure to be here tonight, and thank you for everyone for joining. And we're just so excited. It's hard. We're just sort of in this wonderful, amazing space. I would attribute the success of our students to just the students. I mean, it's their hard work, it's their dedication, they're digging in, they're doing the work, and they're following the program. And what I think is really special here is we have this special program. We are a new school. We have these amazing outcomes, but there's something that's different about a fresh, innovative new school. We're not bound by, past experiences or past institutions. We could harness these best practices in medical education, bring the best faculty together, the best colleagues, the best team together. And we said, we're going to upend this. We're going to do active, collaborative, innovative, clinical focused learning in a fresh new environment. And so I attribute all these things, the team, the faculty, but most the students. I mean, the students did this. They achieved these outcomes, and we couldn't be more proud. And it's awesome. So
Amazing. Thank you. Well, let's go to the students. Uh, Nicholas and Tiffany, we'll start with you, Nicholas, and then we'll go to you, Tiffany. Please reintroduce yourself to our audience. Let us know where you did your undergraduate work from and what your majors were. And then I'm going to say, tell us, Nicholas, one thing that you find amazing about Freeport itself, and Tiffany, you tell us one thing you find amazing about Chicago. How's that sound? We're going to mix it up a little bit. So starting with you, Nicholas.
Okay, sounds good. Hi everyone, my name is Nicholas. I'm from Louisiana. I went to McNeese State University. And one thing I find amazing about Freeport is one, the weather, two, the beaches, and how welcoming everyone in Freeport is. Anywhere you go, the locals are always willing and ready to help you. And everyone's very, very excited to have us here. So it's awesome.
Amazing. Thank you. And Tiffany, how about yourself?
Hi, my name is Tiffany Fan. I went to Virginia Commonwealth University. I was a psychology major. And one thing I love about Chicago is just all the things there are to do, from all the great foods to eat, lots of museums, parks to see, just a lot of fun things.
Amazing. And Tiffany, coming back to you really quickly before we sort of get into the meat of today's information session, give me one thing that really stood out to you about WASM as you were a prospective student.
So, other than the beautiful beaches there, I think I had the chance to be on the WASM cruise and see WASM and interact with some of the students and faculty. And I just really got the feeling and the sense that all the faculty and members there really, really cared about our success, and it was their success too. So I could just tell that we were going to work together as a team.
Amazing. And how about for you, Nicholas? What stood out to you?
What stands out to me about WASM is one, the small class sizes and how well the faculty knows every student. Like, I've personally had faculty members come up to me and just like, hey, how are you doing today? You seem like you were kind of confused in class. Is there anything you want to work on or you feel like you need to work on, like what you need clarified? So it's the one-to-one interaction and knowing that they actually care about our education and are willing to work with us. As long as you're willing to work hard, they're willing to work just as hard to make sure you succeed. And I love that.
Thank you so much for sharing. And I'm going to go to a question here in a minute from the chat. But before that, to put a button on this kind of section we're in now, Dr. Welke, what would you say is the WASM difference? Both you and Dr. Wales have worked at both international medical schools and at domestic U.S. medical schools. What do you think the WASM difference is?
Yeah, no, I think that great question, and thank you. I think the WASM difference is what Nicholas has said. We're open door. We look at our school as a community. Our success is the student's success, and we're there. We treat each other as a team. And I think that also the difference is our curriculum. We've taken best practices. We have a program here that it was built by MDs for MDs. So we know you're not coming here to get a PhD in biochemistry. We know that, so we've built a program that is all based on really illness scripts and disease, and why should students care about learning these complex metabolic pathways? Because you have to learn it for this disease state. So you're not taking a course in anatomy or physiology or that, these courses, everything is integrated and it's all clinically driven. You're coming here to learn to be a physician. And so we've focused on that. We've really tossed the apple cart over as far as this is how we're going to teach. This is how we've built the curriculum. And I think that's really the WASM difference. Our curriculum, our students, and our community type open field.
Amazing, thank you. And Dr. Wales, I wanted to come back to you about what the WASM difference is, and then I'm going to ask you a couple questions that came up in chat, and then we'll move on to some other topics. So what for you is the WASM difference? You are muted.
Sorry about that. I agree with everything Dr. Welke said, and I would just add that I think we're a community of people who care about one another, right? So, historically, medical schools have been places where you go and it doesn't feel like you're cared for very much, which I've always found ironic because we're creating, or we're helping people become healthcare providers, but yet we don't care for them along the way. And that, I think, at WASM, everyone really cares about the student's success. I think the students care about it. I think they help one another. The faculty care about it. The staff care about it. We just all, I think, are rowing in the same direction. And you don't always find that. It's sort of a special place. And I think it's pretty exciting. Not that I'm biased or anything, but.
Amazing. So a couple of questions came up in chat specific to Match, and I know we're going to sort of be talking more about Match as we move along. But I know as a prospective student in the past, when I get a question in my head, I become narrow focused on hearing that answer.
Okay.
So I want to get some answers out there so that people will be open to hearing what else we have to talk about. So the first question is, can you talk a little bit about the specialties that students matched into?
Oh, sure. Okay, so I'm going to pull them off. So child neurology, we had child neurology, we had emergency medicine, we had a combo emergency medicine, internal medicine, which is a really tough program to get into. There aren't many in the country. Family medicine, of course, general surgery. We had internal medicine. We also had med peds, which is another tough one to get into. We had pediatrics. We had PM&R, which is, for those who don't know, physical medicine and rehabilitation. Laura, can you think of any others that I've forgotten? I think we had multiple in surgery, multiple in pediatrics, multiple in emergency medicine. Did I say internal, just internal medicine, general, just regular internal medicine? Okay.
Child neurology, yeah.
Yeah, I think that's, off the top of my head. And they went to great programs. We have one student at University of Wisconsin. You didn't ask me that question. Do you want me to go there?
No, that's okay. Go ahead. Yeah.
So we had University of Wisconsin. We had University of Mississippi. We have East Carolina University. We had University of Ottawa, for crying out loud, which was a big one. We had Florida State.
Indiana.
What?
A couple, Indiana.
Oh yeah, Indiana University School of Medicine. That's right, for PM&R. We had Detroit Medical Center. I'm trying to remember. University of Illinois College of Medicine. We have someone who matched in surgery at University of Illinois.
And then Parkwood Internal Medicine. Yeah.
Yeah, that's right. So we had great matches. Not only did our students match, they matched, really matched at great places.
And how many of the students matched into one of their top 5 choices, would you say?
You know what? So I don't know the answer to that question.
Okay.
Well, but I would tell because I didn't ask that question. But what I will tell you is I don't think there was any student who didn't get what they were going for, at least what they told us they were going for. So
Okay.
we as a school are not privy to what students put in their preference, right? So they tell us what they want to match into, and we help them get there. So I don't think there were any surprises there. I think I think everybody matched where they wanted to. Like, what I don't know if it was their first choice or their second choice, but
Okay.
everybody got the specialty they wanted, and
Okay.
several people got the specialty at the location they wanted. So sorry, Chris, I
Amazing.
don't know the answer, but I think all of them. I don't know.
No, it's totally okay. I mean, we also, and that's a good segue to let you guys know that May 2nd, or no, not May 2nd. I'll think of that date for you. But we have another virtual information session coming up where we're going to actually talk all about Match.
May
And I'll get
6th.
that date. May 6th. Thank you.
Yeah.
So on May 6th, so we'll have that where we'll get really dive deep into the Match. And then I'm curious to know as we move into talking about curriculum, can you talk about the size of our first cohort and the sizes of our cohorts in general? Because we're a fairly small school, but I would prefer for you to talk about that.
Me or you with the
Yeah,
students?
yeah,
Oh,
Dr.
okay.
Wells. Yeah.
Okay, sure. Yeah, we are intentionally small. We're intentionally small because we think it's important. You're probably going to ask about the curriculum, but we are very intentional about having a highly integrated curriculum. So there's a very low number of students to faculty. We do that because we know that medical knowledge doubles every 72 days. At least that's what it was when I last Googled it. You can Google it tonight, maybe correct me. But so what that means is it doesn't make sense anymore to teach students information where they gorge information and then they purge it on an exam. The knowledge doubles so quickly that the only thing that my belief is that the best way to teach students is to help them learn about medicine contextually and help them be able to assimilate information. At our school, we call it becoming master adaptive learners, right? Because the information is going to continue to double at a very fast rate. I'm old enough that I remember when it doubled like every 15 years. And then it went like every 10 years and every 5 years. And we were all like, oh man, it's doubling every year. And now it's every 72 days. So when Tiffany's practicing, it's going to double even much more quickly than, this old lady remembers. But so that's what I think makes the difference for us. We intentionally have small classes. Students get a lot of interaction with faculty, both basic science faculty who talk about the basic science underpinnings of what's happening, as well as clinical faculty, so they can talk to the clinicians about the presentation and how a patient might present.
Mm,
And we also focus on cases. We know that master physicians don't necessarily remember their biochemistry lectures, but they
Mhm.
do remember their patients. They remember their cases, whether they're simulated patients, whether they are standardized patients, whether they're paper-based patients or cases
mm.
that they've talked about in class. They remember the patients. So I could talk to you a lot longer. I'm going to stop because I
No,
could
no, it's okay.
like
Well,
conversation. I'm in love with our curriculum. I think it's fantastic.
well, let me segue over to. I want to ask this of you briefly, Dr. Welke, and then I have a question for our two students here. Dr. Welke, can you talk a little bit more about the integrated? Both you and Dr. Wells have sort of alluded to the integrated nature of the curriculum and the flipped classroom, but can you talk about how those two things work in conjunction with each other?
Yeah, sure. So just to give a little idea, at WASM we have two courses each semester, and the courses are Foundations of Medicine, which is what you think of in the classroom in the morning. You're going in your through your classroom sessions. We have a flipped classroom where students have to do a little bit of pre-work in order to come to the class prepared to, like Dr. Wales said, work through problems, work through cases, discuss patients, and that kind of thing. So that's Foundations of Medicine, and I'll explain a little bit more. But then we have patient-centered care. So those are our two courses. So the example I like to use is in semester two. Um, in each semester, there's units. So we call them organ system units. So in semester two, students do cardiovascular, respiratory, and renal. And so what we mean by integrated is they're going into class and their classroom session will be on hypertension or diabetes or interpreting EKGs or pneumonia. So you see that all of these sessions are, they're revolved around a disease state or illness scripts. And so they go into a session and you might have an MD there and a pharmacologist and an anatomist, and you have all the faculty integrating together talking about hypertension. And so you're getting all of the different, like Dr. Wales said, all these different threads coming together into a story, and so they're working through this during the week. In the morning, case-based problem solving, patient scenarios, talking through discussions. And then in the afternoon, they go to patient-centered care, and that's where they're using their skills. So in cardiovascular, then they're coming into the clinical suite and doing heart sounds or respiratory sounds. And so it's integrated across disciplines, but also it's integrated between foundational, the written test knowledge and the clinical skills. And it's so logical. We've made a really logical flow, in my opinion, that it makes sense for the student learning and progression. We do a lot of spaced repetition and building upon concepts and material to make it really sticky for students and memorable, like Dr. Wells said.
That's interesting. And I'm curious, I want to go to Nicholas and then Tiffany, I'm going to ask you a follow-up. Nicholas, you're sort of in the middle of this pre-clerkship curriculum. What has the experience been like for you thus far?
So the experience for me, it's whenever you're doing the pre-work, a lot of times it seems like so much information. It's like, oh my goodness, how am I possibly going to learn all this? And then you go to class, and like Dr. Wilkie was saying, you have the anatomist there, you have your MD, you have your physician, and you have your pharmacologist. They paint such a beautiful picture for you. Like you get the anatomy, the physiology, the path, and how to treat a patient, and how the patient's gonna actually present to you in the clinic, because the patient's not going to come up to you and tell you like, hey, my heart's hurting, like I think I'm in this arrhythmia. So it just brings it all together, and it makes it really stick because it's a story. It's not just words on a page. It's actually something that you're seeing and you're living, and it makes sense because it's a story.
Thank you. And going to you, Tiffany, you're now in your third year, so you are actually you are seeing the outcome of this those first 2 years of education. What has your experience been like now being hands-on with patients? And and I have a follow-up after you answer that. Sorry. So what would you say has been your experience thus far and how it relates to you working with patients now?
Yeah, so I think one thing that the flipped classroom setting and WAUSM's curriculum really did for me was kind of teach me or develop my skills to be more confident in giving answers. And the one thing that all your attending doctors will ask you when you're in your rotations is a bunch of questions. And while they want you to be right, they also want you to be confident. And I feel like I have definitely excelled in that because of just the learning style and the lecture style we had at WASM.
And now this is asking you to maybe pat yourself on the back a little bit, so don't be afraid of that. Do you feel like you see a marked difference between yourself and other students from other institutions in your ability to be confident and to be able to respond to the doctors?
I definitely feel like I feel like I had a really good foundation while I was in my pre-clerkship. And then so sometimes even when I don't exactly 100% know what an answer is, I feel like I had enough to come up with an answer that will be valid. And if not, I can always look it up too. But I do feel like I have some sort of an advantage in that I feel confident with myself.
Okay, amazing. Very, very cool. So I'm curious to know, Dr. Welke, if you could walk us through the type of assessment tests that WASM incorporates into the curriculum and the rationale behind the approach of those assessment tests.
Yeah, so I think something really cool that we do is we have quizzes. We call them summative quizzes every Monday or most Mondays. and because we know as humans, we like to procrastinate. And like Dr. Wells said earlier, we don't want students to like binge and purge, like, oh, I have an exam 4 weeks, I'm not going to do anything for 4 weeks. So we do like really nice little quizzes every Monday. They're just like 10-question quizzes. But what it helps students do is keep on top of things. So the quizzes are always from the material the week before, or maybe a little cumulative with concepts. So we do these quizzes throughout, and that's a part of the final grade. And then every term, there's four in Foundations of Medicine, there's four major assessments, like what we call them summative exams. And those are all MBME style questions. And so those are, we make sure that they're written in the style that students would see on the USMLE or their other licensing exams. We do a lot of working with questions in class to build, like Tiffany saying, that confidence and in the knowledge and really conquering these type of questions. And we do a lot of that. And so it's building practice questions, working with questions, problem solving, and really getting them, feeling confident about the material and tackling these questions, because there's a lot of strategy that comes into these licensing exams. So in my opinion, I feel like it's a really good mixture of assessment tools and also strategies on how to learn all this complicated content knowledge. So,
And talk to me a little bit about, you and Nicholas are sitting in front of one of our simulation labs. So if you could talk to me a little bit about how the simulation lab is embedded into the curriculum.
Yeah, so what you see behind us is the simulation. We have 4 simulation bays. We have high fidelity, what we call Apollo 3G mannequins here, and they're part of the patient-centered care course I was talking about. So in the morning, you're doing these, the foundational, the working with questions and problem solving and all of this and learning, the medicine, but then you're coming in here to apply it. And so the students come in and they work as a team in a simulated environment with the mannequins, just like you would with a flight simulator. I would hope that a pilot was in a simulated environment, just so this offers our future physicians that kind of training. And so you see here in the video, this is some of our students working on these mannequins. They can do CPR. These mannequins there's some heart sounds that they're doing. They're very, very sophisticated mannequins. They can sweat, they can cry, they can do all these things. Here's some bowel sounds, heart sounds. In addition, we do standardized patients where we bring in actual patient actors, and students can practice on these live patients the different clinical skills. We also bring in what we call professional patients that may have a disease, like either different heart murmurs or heart sounds or diabetes or other. But this gives them in an environment to practice their skills, do the write-ups, talk it through with faculty, and like Tiffany said, gain that confidence that they need to enter the clerkships. You'll see here we record all these sessions so we can go back and speak to students about, okay, how did you feel it go? How did it feel it went? What went right? What could we improve upon? And that kind of thing. So it's a very sophisticated center. And I think it's one of our cornerstones. So the students love it because they feel like they're a doctor in there and they get this really hands-on practice.
And this question is going to go to Tiffany, and then I promise you, Nicholas, I'm coming back. Got a question for you, but I'm really curious how your work in the simulation lab has translated to your work in the 3rd year.
Yeah, I would say that in our sim labs, we had so many opportunities to practice doing history, physicals, and working in like a real life simulation crash event. So when I came into my clerkships, and now I'm in my 4th one, so I feel pretty good, pretty confident about seeing patients and jumping into surgeries and, helping out where I'm needed, but having that ability to practice with my fellow students on a patient where it's not actually life and death was very, very helpful and made it more familiar and much more doable when I've been doing it on real patients.
Amazing, thank you. And Nicholas, I'm curious to know how the work in the sim labs and the work in patient-centered care classes How is that related to your work in foundational medicine classes? Do you find that that is helpful for you?
Yes, sir. Very much so. I actually love our patient-centered care and our simulations because you get to take what you learned in the classroom, what you spent all these hours laboring over, and you get to apply it to a real situation. You get to see how it's going to be presented to you in real life, and you get to interact and adapt and see how the flow of things go. And then we have our physicians there watching us, and after we're done, we have a brief summary where they tell us what we did right, what we did wrong, where we can better ourselves, and it's really awesome to be a part of.
Amazing. And tell me a little bit. Tell me a little bit about what life on Freeport has been like. I'm going to ask. I'm going to go ahead and ask you my follow-up. So the base level question is, what has life in Freeport been like for you? Like the transition from where you were from to Freeport, and then the follow-up is, and what has it been like as a new dad, being a medical student in Freeport? Talk to us about that.
So life in Freeport is honestly amazing. Whenever I was moving here, I was not expecting to enjoy it as much as I do. But like anytime I'm stressed out, you go take a walk on the beach. Me, my wife, and my daughter, we go on walks on the beach, watch the sunset. Like I said earlier, everyone in Freeport is so friendly. Like people at the
Mm.
airport, people at the grocery store, they know we're new here and they know that we're trying to adapt to life here. So they're very friendly. They're very willing to help. But as a new dad, it definitely gives me the extra motivation that whenever I am tired of studying to get back in gear and work harder. Um, and it's been amazing to watch my daughter grow up on an island and to watch my wife stay at home and raise her. So it's been a real privilege.
Amazing. And Tiffany, we're going to transition over now to talking a little bit more about clerkship. What was the transition for you between Freeport and Chicago like?
Um, it was kind of a lot because at least I moved to Chicago in the summertime, so it was really nice. But I think getting acclimated in my first rotation while still trying to do all those things like furnish a whole new apartment and get used to the area, be reacclimated with traffic and a bunch of people. It was a lot, a little bit of a transition for sure. But I honestly love it here in Chicago just as much as I loved it in the Bahamas too.
Nice, nice, nice. Yeah, you definitely, as students, you go from a very tropical climate to a very, I think it's safe to say, colder climate in Chicago. And I personally love Chicago, but so it's very different. I'm curious to know, now that we're talking about curriculum, if you, Dr. Wells, could give us a brief, sort of a broad overview of the clerkship curriculum and how it actually prepares students for residency.
Sure. So our students, when they transition from Freeport to Chicago, they will participate in what's called, I'll call them the required clerkships. So there are 6 required clerkships. Students spend 12 weeks in internal medicine and 12 weeks in general surgery. And then they spend 6 weeks each in family medicine, pediatrics, psychiatry, and OBGYN. So they do that, and that's sort of the core for the 3rd year. And then the 4th year, they must take either an emergency medicine or urgent care uh, rotation. We call that a selective. And then they must do what's called a sub-internship. And a sub-internship is really important to prepare students for residency because what it is a situation where students take on additional workload and they function like a resident. So when you are applying for residency and they see that you have a sub-I on your transcript, they know that you know what it's like to be a resident. You've actually had to do that before. So not all schools require that, so that's important that we require it. And then I tell the students that uh, after that, they have electives. And elective time, I believe, is worth its weight in gold. It's worth its weight in gold because it allows you to do things you might not get to do otherwise. It allows you to do audition rotations. So if you're a person who says, you know what, I really want to be a pediatrician and I want to match in New York City, right? We can get you a rotation in New York City in pediatrics, And it's up to the student to do really well, right? So we'll call some of our friends and say, hey, I've got a great student who wants to do peds there. And the student will go. And if they do a great job, then they're more likely to be invited back for a residency interview. So we do that because we are smaller, as we've said, we give every single student tailored guidance for whatever specialty and whatever location they want to match into. So,
Mm,
like somebody in the chat said, "Did you have any Bahamians and who graduated or who matched?" And was the process the same? And the answer is, well, yeah, absolutely. We had a Bahamian match, and the process was the same in terms of applying for match. What was different was that Bahamian needed a program that would sponsor a work visa, right? So
mm,
at WASM helped that student do that. We also had a student match into the Canadian match. So we helped that student prepare their application so they were most competitive for that match.
mm.
We also had a couples match, right? Like of all the different matches you can have, we had it in the first group. So we had a couples match. And what that is, it's a couple, two people who say, hey, we want to go to the same geographic area. And that's not an easy match sometimes. That's a very difficult situation. So we worked with both students. We knew what the students wanted to match into. And because we have a lot of experience and a lot of connections, we were able to help those students get the audition rotations they needed to be successful and get what they wanted. So I probably answered more than what you wanted to hear, but that's how I think how we get students ready for residency.
Yeah, no, I think that's great. And I'm curious to know, while we're still talking about clerkship, what are the sort of performance evaluations that are given to students during clerkship, and how and why are they effective
Okay,
methods of evaluating?
super. So there's really three primary assessments, if you will, that contribute to the grade that a student gets in a clerkship. One would be the faculty's evaluation of the student. So every student will rotate with an attending or a faculty member, and that person then evaluates how the student interacts as a physician, right? How they behave as
Mm,
a physician. That's really important because, you know, medicine is one of these funny beasts in that it's very science based. So sometimes students come to medical school and they've done really well in all the exams, right? Or they wouldn't be in our classrooms. But the first time they're evaluated for like, how do you communicate with someone? Or did you show empathy? They're like, I've never been tested on that before, right? But that's how patients measure success in many cases. So that's not a surprise evaluation, but a new evaluation for some students. They're also evaluated, their knowledge base is evaluated using an NBME shelf exam. And then every student has essential patient encounters, like patients they need to see and skills they need to perform. So, and they keep track of that in a log. And the way the log works for our school, which I think is extremely important, it is you must see all of these patients and you must do all of these skills. If you don't get the points. And it's like 50 points out of the 100. So you cannot pass if you don't do is that right? Or is it 25? It's 25. Tiffany, help me. The log. 25?
Yes.
Yeah, I believe it's 25.
25. And it's all or nothing, right? You either do the log or you don't do the log. So there's no way you can get out of our school without learning to do an IV or like learning to, do a pelvic exam or doing the things you need to do, which I
mm.
think is important. And that just sets students up for great performance.
Amazing. Thank you so much. Thank you. So we're kind of getting a little closer to the end here. So I've got a couple more things I want to address, and then and questions I have to ask, and then I have a couple questions from chat that I want to ask. But I'm curious to know, Dr. Welke, WASM has designed, by design, has student success at its core. And I would say for myself, outside looking in, I think it's one of the most integrated student success platforms with curriculum that I've ever seen. And I wonder if you could discuss the academic support system, the learning resources which are available for students, and the exam prep tools that are available for students outside of the classroom within the student services world.
Yeah, absolutely. And I think one of the things that in my opinion, I'm most proud of is all of our faculty here are full-time. They live here on island. Their focus is medical education. They're excited. They're into it. They're here, and that provides a constant, stable support for our students. And I think that's very, very special. And that's how dedicated they are. So that's one piece of support. And the faculty have office hours, and they're part of also our Center for Academic Success. And Dr. Wales will say this, it's a center, but it's also a community, so it's this wraparound sort of support structure within this academic success. So we have what we call CAS sessions built into the curriculum, where we might do post-examination reflection or working with questions, or maybe some just in time, like, we might notice, okay, this cohort of students, we need to do a little bit more time on pneumonia. So we might have a CAS session on that, or let's work through some questions, or let's do some exam prep during a CAS session. So we sort of mold and shape that dependent on student needs. Or some students may say, hey, can we have a review session? Can we have a CAS session on respiratory physiology? That was really hard. Can we do some questions? So we're flexible, and we have these sessions built in. As far as our resources, my goodness, I have never been at a school that supplies as many resources as we do here. We provide, oh my goodness, library resources, all sorts of books, textbooks, journals, everything is online 24/7. We supply osmosis, we supply AMBOSS, we supply UWorld starting in semester 2. What else? I mean, it's just there's so many resources for students to tap into. And it may sound like overload, but different students like to do different things. And so you can grasp on depending on if you're visual or if you're using different study tools. We also have peer learning partners. And so for most of you, that's like a tutor, a teaching assistant. So our upper semesters will help out some of our lower semesters. So that's a really robust and important program. So I think that there's just so many, we just provide so many opportunities and avenues based on the student and their individual needs. Of course, they can always seek out advice from members of the CAS or faculty to sit down and talk about their unique own learning needs and style.
And this leads me to sort of a follow-up, and I kind of want to give this to you, Dr. Welke and Dr. Wales. And I want to preface this by saying, this can be a bit of a touchy question, because I know that the people coming into these virtual information sessions may come in thinking this is all just a big commercial rah-rah, right? But I also like for us to answer questions, right? I'm curious to know how this support that you're talking about, Dr. Welke, because I know the answer to this because I see it, but I would love for you to articulate how it directly relates to our retention rate and how it helps set students up for success.
Goodness. Well, maybe like Nicholas or Tiffany could help me out with that, because every single student is different, and we try and meet them where they're at. And we try and gauge that. And I think what you said earlier was really important. Like, if I'm in a class, I can sort of gauge, like, okay, we might need to spend more time on that. Or I might go up to somebody, do you need more clarification on that? And I think that lends to our small class size, where we're able to, our students don't get lost. Do you see what I mean? Like, if you're in a classroom of 200 students, people, are you going to get the amount of, this boutique really caring experience? So I think, that's what I would say, but I think you probably have some.
Like today, for example, we had a CAS session with one of our professors because the material we learned last week in Reno was very, very heavy, very nitty gritty, very hard material. And he realized that we were struggling with it a little bit. So he took the time out of his schedule today to meet with us, and we worked through problems. We went through the lecture basically again, and we were able to ask questions and figure out where our gap in the information was, and we fixed it. So that's just one example. And then, like you were saying, the peer learning partners, I'm a PLP, and I also still use the PLP because it's amazing. Like, you get their perspective on it. The person doing it loves it because they're reviewing the information. So it's amazing.
I think too, if I may just add, like, we we accept vulnerability and we want curiosity, we want questions. If people come here to learn, and if you already knew everything, you could go and take the steps and be a physician. And so we offer that vulnerable, open, caring environment because we know everyone's coming here to learn, and we know that this is very, very hard. It might be the hardest thing you do. And so I think all of that support and that openness and this community drive and all of that lends what you're saying, Chris, about student success and retention and all of that.
Amazing. Thank you. And I'm curious to go to you, Tiffany, once again, because it's sort of like the way I'm looking at this in my mind is like Nicholas is representing sort of the beginning of the journey, and Tiffany, you're representing like the middle of the journey, and our students who've matched have represented the end of the journey. So for you, how have these resources how have they helped you in your clerkship?
In clerkship, I feel like it goes back to building a really good study foundation for me. I felt like when I was on the island, I really, whenever I felt like I need help, was able to reach out to the professors, have sessions. I was a PLP as well, I still am. And so that was a great way for me to review old material as well as get new ideas from students I was PLPing with, and then into clerkship, have all that foundation that I built has just helped me be able to grow on that and like do a lot more self-study. But today in clerkship, we still are followed. I remember after my first shelf exam, we had a meeting with OSA, and they honestly met with everyone, regardless of if you did well or if you didn't do so well, to see how you're doing, how they can help us academically, and any thoughts or notes. And that's something that we have a lot of meetings and opportunities to give feedback and just feel like we have the school there to support us.
Amazing. Amazing. And a couple more questions here. And I'm curious if moving on, Dr. Wales, if you could talk a little bit. This question's come up a couple times in chat, but I want to sort of give the short answer, and then I would love for you to expound upon it. So WASM has 3 start dates a year: May, September, and January. And would you please expound upon the differences and similarities of those start dates and how they're almost on some level built for different types of students?
Sure. Thanks for that question. Chris knows that I could argue that every single one of those starts is the best start for different reasons for different students. So you'll have to figure out which works for you. So if you start in September, so I'm picking September because that's sort of the normal start for the school year, at least in the US, usually start in the fall. So you can start in the fall at WASM in September. It'll be like what you've probably experienced in undergrad, and you'll make it through in 4 years and you'll graduate, right? So that's the normal progression. However, and this is where it gets really kind of interesting, you could start in May here, right? So that's a couple of months before September. And for those students who do that, they have some built-in flexibility in the curriculum. So what that means is some of those students they could study for step 1 a little longer if they wanted to. They could study for step 2 a little longer if they want to. They could have a baby if they want to or get married. They could do extra electives. So they have a little bit more time to do those things. And if they're a student who really wants to match into one of those specialties that has an early match, that allows you to get all your requirements done before you go through the match. The match is once a year. So I could argue that September's a great place to start. It's the normal place to start. I could argue that May is a great place to start because it gives you a little more flexibility. And I could also say that January gives you the most flexibility. And why I would say that is January either gives you 6 weeks on the front or 6 months on the front end, so you can take more electives, take more time off, study, or you can really go fast and finish in sort of the very end of 3 years. So January allows you to like race through as long as you have no problem. And I'm not recommending that you race through. Please don't misunderstand me. There are some students who want to do that. And if they want to do that, they can start in January and make that happen. They can also take it at a I was going to say a little more leisurely pace. There's medical school is not leisurely, no matter how you look at it, but at a different pace than the normal.
Amazing. Thank you so much. And thank you for your answers. And the final question I have for you, Dr. Wales, if you could just briefly touch on is our is the various places where students can actually do their clerkship, because we have more than I mean, we actually have two clerkship homes in Chicago. I mentioned that in the front end, but there's other cities people can do their fourth year, correct?
Oh, absolutely. So the core clerkships are those ones that I told you, the six where students take internal medicine, surgery, all those. We put those intentionally in one place. There are some schools that will have you um, go 6 weeks in California and then another 12 weeks in New York and then 6 weeks in Arkansas, and you'll zigzag around the country. I don't think that's the best for education. I think it's best if you're in one place for that whole year. So we intentionally picked Chicago. We have multiple hospitals in Chicago. So not only do our students rotate at St. Anthony Hospital, they have rotated at Insight, and they've also rotated at Resurrection. So we have some surgery students at Resurrection. We have the ability to do clerkships, core clerkships in Nassau at Doctor's Hospital. None of our students have done that yet. But so that's third year. Fourth year, though, fourth year is full of electives and sub-Is and selectives that I talked about earlier. You can do those anywhere, right? So some of our students choose to stay in Chicago, but many of our students have chosen to go. We've had students go to New York, we've had them in California, we've had them in multiple places. So it's kind of like the world's your oyster once you get to be a fourth year. So I'm curious. It's not my place to ask questions, but I haven't talked to Tiffany about this, so I don't know if she's been thinking about electives outside of Chicago, but I was just wondering.
Yeah, Tiffany, what have you been thinking about?
Yeah, I think
Putting you on the spot.
it's still a little, I have two more rotations till I'm done with the core, but I have been thinking I would love to go. I'm from Virginia, so I would love to be able to go do one in the DMV area or elsewhere, but I also really love Chicago. So I just, once the new elective list is released, then I'll be excited to see where I can go. And another nice thing about our school is if there's somewhere we want to go for an away elective that may not be on the list, then we can work with OSA to try to get their help so that we can make that work.
Amazing. Thank you.
Mhm.
Dr. Welke, what advice would you give to a student who's considering WASM for their medical education?
Oh goodness, this is the question. I think if my advice is to, like I mentioned earlier, is this might be one of the most difficult things you'll do as far as, Dr. Wales and I always talk about this. There's going to be a lot of joy. You're going to have many days filled with this is amazing, and then you're going to have bad days. You're going to have good days, and so I would get really really get yourself ready for this journey. And I think if here at WASM, if this piques your interest, our small class sizes, our supportive environment, all of that, we're here and ready to welcome you. Yeah, it's just getting ready for that journey, I guess. This is always a hard question for me. Like, so.
Dr. Wales, what piece of advice would you give to a prospective student?
My piece of advice would be along those lines, and it would be
Amazing.
that medical school's tough. It really is. And you're going to have bad days. You're going to have bad weeks. You might even have bad months or a bad semester, right? And that's inevitable. So wherever you end up going to medical school, make sure you choose a place where they will support you, even on those bad days, because they're inevitable. They're going to happen. So you need to be at a place that can buoy you up when you're in that space. And if you're thinking about WASM, that is a place where we do that, but there's also reciprocity here. And what I mean by that is if Dr. Welke's having a bad day, I got to buoy her up. And if I'm having a bad day, it's reciprocal. So that is part of our community. And so I would say that the most important thing that you can do when you're figuring out where you want to go to medical school is figure out where you feel like you fit and
Mm,
that you will be taken care of when you're most vulnerable because you will experience vulnerable moments in medical school.
mm, mm,
So
mm.
make sure you're at a place that will catch you.
Yeah, definitely. And I feel like that really mirrors what Tiffany was saying about even when maybe not knowing the answer, having the confidence to be able to talk about it and talk through it. And I think confidence comes from being in an environment. Sorry, I'm gonna talk for a minute. But I think confidence comes from being in an environment where your ability to be vulnerable and to not be expected to be perfect is really valued, because ultimately I think sometimes, and this is me speaking from my perspective, students will take not knowing something as somehow a personal, like that they've done something wrong or there's something wrong with them, when really at the end of the day you're not going to know everything. And one of the most powerful things you can say as a student is I don't know,
Mhm.
because it shows that you are willing to be honest about your knowledge base, and then you're open to learning. So I'm going to button my mouth because I could talk all night about this. Nicholas, you at one point, my friend, were on the other side of a computer watching one of these virtual information sessions. What would you tell someone if you could speak to one person watching this information session right now? What piece of advice would you give them?
Um, I would say that watching from the other side of the screen, I remember being scared to start medical school, nervous because it's a new place, a new country. I had never left Louisiana before. Um, but I would say that medical school is the hardest thing that I've ever done in my life for sure, but it's also the most rewarding. And I couldn't be more happy that I'm at Awesome. It's definitely the best decision I've made so far. And I would say to come see the school, come see how welcoming the faculty and the students are, and come visit the beautiful island and see for yourself. That's what I would say.
Oh.
Amazing. Thank you. And Tiffany, what piece of advice would you give students?
I was going to say something on the lines of what Dr. Wales said, but since he kind of already got that down, I would just say be open to new opportunities that come your way. And I felt like WASM was pretty new when I first joined, and I didn't know how it was going to go. And I'm very happy with my decision to be here.
Amazing. Thank you so much. And the piece of advice I would give all of you watching is don't let perfection get in the way of progress. If you're interested in applying, apply now. One of the jobs that I do as a senior enrollment manager, or any senior enrollment manager that you work with, is our job is to help you through the process of applying. And if we think you're going to be a good candidate, and there's a lot of ingredients that go into the stew of being a good candidate, um, the analogy I like to use is that all the ingredients are the same. It's just the measurements that are different per student. But our job is to, if we think you're going to be a good candidate, is to help you through that process to put you in a good light. And that could include giving you feedback on personal statements, walking you through mock interviews. The idea is that we're here to help you. Cool. I think that's all the time we have for now. There are some questions that came up in chat that we weren't able to address. So please know that we saved this chat and we will reach out to you individually to answer those questions. But for now, I want to thank Dr. Welke and Nicholas for joining us from campus. I want to thank our buddy in the background with them. I don't know that he has a name, but I'm going to name him Biff. Tiffany, I want to thank you for joining us from cold and windy Chicago. Dr. Wales, thank you so much for joining us from Indiana, and I'm coming to you from New York City, which is a little balmy and cold, as I discovered. And I also want to thank Xavier for answering questions, Tibian for checking people in, and thank you so much to Teddy for running our all of our tech. That's the word I was looking for. And once again, last couple things before we go. Nicholas mentioned this, and Tiffany mentioned this idea of visiting an island. Now we no longer do I think Tiffany came to the island on a cruise ship. We don't do that any longer, but we do offer student trips to the island, which are reimbursable to you. So our next student trip, if you are feeling really aggressive is next week, April 9th. But if a week is a bit of a turnaround for you, I get it. After that is May 21st, and we will have some student trips coming up after May 21st. So we'll be in touch with you with that information. But once again, if you are interested in starting your application, I would say do so tonight. Don't wait. Start tonight. That's the best piece of advice I can give you. Once again, thank you all so much. We will be reaching out to you to answer questions that you may have had. There were some questions that were asked that they're more individualistic. And we'll reach out to you to answer those questions. So thank you all so much, and have a great night. Thank you.